Howdy everybody, welcome to my Poop Tip Tuesday. I want to thank you guys for joining me today on my live video. So we have a great show today. We have a lot of great questions that people asked me in the past 2 weeks. We'll talk about H. pylori, what to do about resistant H. pylori. We'll talk about what is considered a normal bowel movement. People ask me this all the time. What is normal? What is abnormal? We'll talk about why you may be having diarrhea, even if you haven't eaten anything. Yes, that does happen. We'll also talk about ulcerative colitis as well, and many, many more, including live questions you may ask me on today's videos. Guys, let us talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right guys, so as usual, let me know in the comments if you're watching this live or on the replay. Also, let me know where you are watching this video from. I love to hear from my audience. And also let me know if you guys have any comments or questions that I may answer for you. Gary, it's good seeing you. B, it's good seeing you on today's live video. All right, first question, number one. This question actually came from Jenny Reyes, who said, hey, Dr. Islam, I've had resistant H. pylori multiple different times. What can I do to get this taken care of? So let me know if you've heard about this condition called H. pylori. Very common condition. A lot of people have this. Let's talk about this. So H. pylori is a bacterial infection inside the stomach that can cause a lot of gut issues. It can cause indigestion, pain, but it can also cause ulcers. It can cause inflammation, and there is a risk of this H. pylori causing lymphoma or cancer of the stomach. In fact, H. pylori is one of the leading causes of both ulcers and cancer of the stomach. And people get H. pylori typically from having food or being around environments that's not very, very clean. And you may get this, and it may be with you for quite some time and not cause any issues, but there may be some triggering event, which we're not quite sure about, that can cause this H. pylori to become active and cause the issues that you're having. So if you've had H. pylori, there are a couple different ways we can test for this. Sometimes we'll have you breathe into a machine to see if you have the active infection. Sometimes we will, yes, actually sample your stool. But yes, we actually do that. But other times I can actually take a look with the scope, see what's going on, and take biopsies of your stomach to see if you have this infection that's there. Now, when we give treatment for this, we typically give a round of antibiotics, but what we have found with the prevalence of antibiotic resistant drugs or bacteria from the prevalent use of antibiotics, the treatments that we used to use for H. pylori do not work as well as what we would like. The eradication rate, the rate of getting rid of H. pylori has gone down, meaning there are so many patients who've had H. pylori in the past, get treated, and they still have the infection because the bug is resistant to the traditional antibiotics that we use. So what do? Well, a couple things. Number one, we have a lot of medications that are coming out and that are currently here that we're using for resistant H. pylori. So sometimes we'll give a different set of antibiotics to help get rid of the infection, and by doing that, we can hopefully eradicate that. For other people, we actually may take samples of that bug and look at it under a microscope to see which antibiotics it is sensitive to. We actually will see this, and that way we can tailor the treatment towards that particular person to see what we can do for that. But sometimes it's a matter of guessing which antibiotics we should use and which ones we shouldn't use. So one of the most important things that you can do is make sure you don't take any unnecessary antibiotics, because this can set you up to have not only a bad microbiome, but also set you up, if you have H. pylori, for this to be a problem for you in the future. All right, great question that I got. Taz, it is great seeing you. Thank you for watching. Ahmed, it's good seeing you as well. Thank you for watching. I will answer both your questions. Actually, Taz, let's answer your question right now. So Taz asks, thank you for watching from Orlando. what are some natural remedies to treat gastritis? Very excellent question. This ties into the H. pylori question. So this depends on what is the cause for your gastritis. So one of the more common causes is H. pylori. There really is no natural treatment for that. We want to go ahead and get rid of the infection with antibiotics. But assuming that's not the case, and assuming it's not the other cause of gastritis, which are anti-inflammatory medications, Aleve, naproxen, Advil, Motrin, things like that. Obviously stop those. But assuming it's not that, what are some natural ways that I recommend? So number one, I recommend as much as you can, try to eliminate dairy. Dairy can cause so much inflammation inside your gut, and people don't realize that dairy is a trigger for a lot of gut issues, gastritis, inflammation, bloating, diarrhea, upset stomach. That's the first thing I do. Number two, I also have you eliminate all processed foods. Processed foods are basically foods that are in some sort of wrapping. You can open up and it's there for you. There's no way, no how that processed foods are good for you. Number three is that I try to implement more of a vegetarian type diet. So as much as you can, get rid of meats, especially red meats and pork and ham. Increase the amount of vegetables, increase the amount of fruit. This will be hard initially because your body is not used to this, but I can tell you over time, you're going to start to feel better as well. And sometimes by adding some of these prebiotic fibers like wheat dextrin or slippery elm or fibers like that, and then also keep in mind these natural prebiotic elements are also included in a lot of the plants that we eat. This will help to naturally control your gastritis. Now, one thing I did not mention are supplements, because supplements are a distant third or fourth or fifth down the line. And I typically don't want to go down that route unless we know we've really made a change in the diet, because no matter how many supplements you take, if you don't fix your diet, you're not going to have any benefit from that. So Taz, I hope that was helpful for you on that great question that you asked. All right, question number two. This is a question I got from Ofrin.mcl. I hope I'm pronouncing that correctly. Hey, Dr. Islam, what are considered the normal amount of bowel movements in a day? I love this question because this is a question I get all the time from my patients who are wondering, hey, am I going enough? Am I going too much? Is it something out of whack? Well, here's what you need to know. The medical definition of normal is going what? What do you guys think? Comment down below. I'm very curious to see what you guys think, what the medical definition of normal is. Well, the medical definition of normal is at least 3 times per week. Yes, per week. And so what that means is that you don't have to go every day. And it's perfectly fine if you don't. Here is my approach when it comes to constipation. Number one, the only reason to take care of constipation is if it is bothersome for you. You have pain, you have cramping, you have bloating, you don't feel very, very good. If you go once or twice a week and you have no issues, not a big deal. You're not going to build up toxins. You're not going to build up anything bad. You're not going to have anything bad happen to you typically from that. As long as you feel comfortable, that's the most important thing. And so for me, I would not focus on the number. That's not a big deal. Focus on how you feel, because even if you go every single day, if you're not having a good bowel movement, if you're not getting everything out, if you're not just proud of that, that's going to be the time when you need to get that fixed and taken care of as well. So that is one thing that I recommend. Don't focus on the number, guys. Focus on how you feel. Do you feel good when you go? Are you proud of it? That's what I want you to focus on for that. All right, perfect. So next, Freg's, good seeing you. Thank you for watching. Sean's good seeing you as well. Thank you guys for watching on the live video. So Ahmed, I'm going to answer your question. So Ahmed Ali asks, are PPIs all the same? I'm taking lansoprazole 30 milligrams for my negative H. pylori ulcers and gastritis, but someone recommended me to switch to 40 milligrams of pantoprazole. Is there any difference? This is a great question. So I will tell you, in general, there are very little differences between all the acid medications. In essence, they all work the same. What they do is that they stop the acid cells from working, and all of them pretty much work in that same way. I will tell you though, there's some subtle differences in terms of the formulation, in terms of how they're released, and in terms of how long they work for each single one. So I'll give you an example. Dexilent. This is one of the newer medications that we have for acid reflux. Dexilent is one of the very few medications in this class that you do not have to take 30 minutes before your first meal. Most of the other acid medications, pantoprazole, lansoprazole, Acifex, you have to take at least 30 minutes before your first meal. Dexlan is one of those where you don't have to do that. And for some people, that's more convenient. Don't have to worry about that. There are other ones that you have to take at a certain time because of how it's released. And there are other ones that only work for about 12 hours versus others that work for about 24. And so there are subtle differences, but by and large, they work pretty much all the same. And it's very controversial in the GI world whether it's worthwhile to consider switching from one acid medication to another versus maybe bumping up one dose that you're on right now. And so it really just depends on each individual person. It's a great question. I'm glad you asked that. All right. Question number 3. And this is a question that I got from Nazar Rahman, who said, "Hey, Dr. Islam, what is the life expectancy of somebody who's had their colon removed due to ulcerative colitis?" It's a great question. So let me know in the comments below, do you know what ulcerative colitis is or have you heard about it? I have a lot of videos on this. What this basically is, this is an autoimmune reaction against your body, specifically your colon, to cause inflammation, ulcers, bleeding, a lot of problems inside that gut. Now, there are a lot of medical treatments that we have for ulcerative colitis that actually work very, very well. We have medications we can give you as a shot. We have medications we can give as an IV. And there are medications we can give you as a pill. But for some people, you may need surgery. And the only way to cure, the definitive way to cure ulcerative colitis is to remove the entire colon because you're removing the disease portion. And when you do that, you are cured from your disease. Now, does your life expectancy change at all? It does not. Great question. So your life expectancy from getting your colon removed is the exact same as somebody who does not have ulcerative colitis. It's the exact same as any other person in the population. So your life expectancy will not change at all based on that. It's a great question. I'm glad that you asked that. All right. So let's talk right here. Andrew, great question. There's a lot of talk. I love this question about stomach acid. All right, I want to answer this because you're exactly right. There is so much stuff on there about low stomach acid, high stomach acid. What do you know? What do we need to know about the evidence? All right. So Andrew asked, there's a lot of talk about high stomach acid. What are some of the effects for low stomach acid, and are there remedies? Okay. So very great question. So if you Google or YouTube stomach acid, I will bet you will see thousands of videos of people talking about how your stomach acid is low, you need to fix it, here's this product to do that, or your stomach acid is so high, here's how to fix this. All right, here's what you need to know. Because I'm going to tell you the truth based on medical evidence and what we know on the research so far. There are very rare conditions in which your stomach acid is too high. Now, conditions like Zollinger-Ellison syndrome, which is a kind of a tumor that produces too much acid, can occur. It's very rare, but it's not something that typically most people will have. And usually we can see this based on various testing that we do. Now let's talk about low stomach acid because this is what you're asking about. So we are finding in some individuals, very controversial, that sometimes low stomach acid can predispose you to have difficulty with digesting certain foods and possibility of an abnormal growth of small intestinal bacterial overgrowth, SIBO. Now, I will tell you this is very controversial because I was part of the initial studies that showed a possible correlation between PPI use and small intestinal bacterial overgrowth, or SIBO, which is the abnormal growth of bad bacteria. However, a recent paper just came out a few months ago that debunked that. So now we just don't know what to do. So we don't know for a fact if low stomach acid is going to predispose you to developing any bad gut issues or an overgrowth of bad bacteria. We don't have any idea for this right now. So the short answer is, Andrew, we just don't know. And I wish we did. But this is the beauty of science because we're doing research. We will soon find out. And then we can hopefully answer that question before. But more importantly, anybody who claims that they know, frankly, has no idea. They don't do the research. They don't read the material. They don't know what's going on. They just have no idea. And so my best advice is we just don't know the answer to that particular question. And I'm really happy that this will give us a better option for you. All right, perfect. So next question. This question I got. Oh, perfect. Here you go. Question number 4. How can you have diarrhea if you haven't eaten? Oh man, this is a great question because it's a very common problem that people have. So if I don't eat, why do I still have diarrhea? So there are a couple of different reasons why. So number 1 is that could be a sign of something more inflammatory going on inside your GI tract. And so one of the more important questions I ask people is, does the diarrhea ever wake you up in the middle of the night? Because no matter how bad your irritable bowel syndrome is, it will never wake you up in the middle of the night. Other inflammatory conditions will, like Crohn's disease, ulcerative colitis, microscopic colitis, which is colitis of your colon that you can't see, but we can see with biopsies. Celiac disease will wake you up in the middle of the night. And so if you're having diarrhea, whenever you're getting up or not eating, or wakes you up in the middle of the night, whenever you're not eating, that is a sign that you need to get that investigated. It's not the run-of-the-mill diarrhea. That means there's something else going on. We need to do further investigation, and we may need to take a look with the scope to see exactly what's going on, to hopefully have a better idea of exactly what could be the cause for that. Great question. All right. All right, Carolyn, great. I want to ask this question. Great question. So, Carolyn, what is the healthiest way to cleanse your system or colon? How long is the healthy colon cleanse? This is a great question. So, I'll tell you, Carolyn, a couple of things. Number one, I have a couple of videos on this. So, I will tell you, first thing, you don't need to cleanse your colon. Yeah, you don't. That's literally the job of what your colon is going to do. That's what you need to do. Your colon's job is to get rid of toxins, to get rid of the bad things that are there. So, any product that's telling you need to cleanse your colon, what they basically have is they have ingredients in them that are pretty much laxatives. They're going to make you just take a lot of poop and a lot of diarrhea. And this is what's going to happen. And they also have ingredients in them that actually may not be helpful for you. You may have caffeine in there that can jack you up. You may have more thyroid hormones that are in there to cause you to have more diarrhea. So you don't need to do that. Here's what I recommend. So number one, keep in mind, you don't need a colon cleanse. If you really don't. You're not going to build up toxins in your body if you don't cleanse your colon. That is literally the job of your colon. But if you're having issues with constipation, that's a different story, because there are different ways that we can treat that, whether it's trying over-the-counter treatment, maybe it's changing your diet, which, like I said before, the best diet that we can find for your gut health is a plant-based diet, and by far the best evidence for that. Maybe adding some magnesium, adding some wheat dextrin or prebiotic fibers, or even a combination of fermented foods. These are ways to help naturally get your colon health better, but you do not need to worry about getting a colon cleanse. You don't have to worry about that. It's a great question. I'm glad you answered that, because a lot of people have this question that they ask me about this. I really want to address this because I don't want you to take anything that's harmful for you, that's going to cause you to have worsening issues long term. All right, another question I got. Hey, Dr. Islam, can certain foods make your hemorrhoids act up? Oh, great. Hemorrhoid questions. So let me know in the comments if you, or maybe you know somebody who's had hemorrhoid issues, because this is really a little pain in the bottom. And yes, there are certain foods that can cause hemorrhoid issues to act up. Can you guys guess what they are? So number one, I have a video on this. Spicy foods. Yes, spicy foods can make your hemorrhoids act up. I have a video on how to deal with a spicy butt. Look on my YouTube page and on my Facebook page. But spicy foods can do that. Number two, foods that are low in fiber. Absolutely, 100%. Fiber acts as a way to help bulk up your stool and to have your stool to be more smoother to pass through, especially soluble fiber. That's what we're trying to aim for. And food that is low in fiber is going to make hemorrhoid issues a lot more difficult and a lot more painful as well. Food number three are processed foods. Yes, I keep on going down this path, but processed foods suck. They're not good for you. If you got hemorrhoid issues, this will make them worse. So keep that in mind. Now, obviously, we have the option in our clinic to fix those hemorrhoids for you. We do it in the office. It takes about 10 seconds. It's quick, it's easy, it's fantastic. This will get down to the root of the problem. But if you're trying to fix hemorrhoids on your own, these are the three biggest foods, the biggest food triggers when it comes to hemorrhoid issues. Great question. All right. So AJ, good question. What do I think about mega doses of probiotics, 200 billion for CFUs? This is a very good question. So probiotics are so controversial in the GI literature. It's very hard for us to know for a number of different reasons. Number one, we don't have a lot of good clinical trials. We really don't. There are very few clinical trials that are out there, and those clinical trials are not the best in terms of how they're run. They're not the best in terms of what patients they recruit, and they're not the best in terms of their outcomes. We don't have a lot of good information on that. Number two is that everybody is so different. So keep in mind, you have a unique microbiome. I have a unique microbiome. What is in my microbiome is certainly not in yours. And we're trying to take this pill that's going to have the same effect on me as it's going to have on you. And I can tell you for a fact, because your microbiome is different from mine, yours may be different from what I'm taking. So this is why I'm not such a big proponent of probiotics. But I will tell you, if you do want to do one, here are a couple recommendations. Number one, it's got to have a lot of CFU. So the higher, the better. And so the fact that you're on a very high one, I think it's very good. Number two is that you want to make sure it can bypass the stomach acid. So make sure it's encoded to the point where it can go past your stomach acid, because your GI tract that has the most bacteria is typically your colon. That's where you want to go. Number three, make sure it's non-GMO. I go for dairy-free, gluten-free, any type of allergy-free, nut-free. You want to minimize the amount of effects that you may be having intolerances to when it comes to a probiotic. And then lastly, make sure you have a wide strain of probiotics that are in that particular capsule that you're using. Make it easier for you. It does not have to be refrigerated. Make it easier for you. You can get one that you can get anytime. And so I am a proponent of probiotics in certain individuals. And for most people, there's very little harm in taking one. And for most people, they may or may not get a benefit. And if you do have a benefit, that will be an added thing that you can add to your repertoire and to your armory to help out with gut issues. All right, great question. All right. All right, I'm just going through here. Great question, AJ. All right, Sebastian, I'm going to answer this question. I think it's a great question. Why does somebody poop for a long time, like 20 minutes? All right, well, let's talk about that. Let's talk about poop. It's what we do. So, if somebody's on the toilet for 20 minutes, I can tell you there's something going on inside their GI tract. The most common reason why people may have difficulty using the restroom for that long is that they actually may have a condition called pelvic floor dysfunction. Now, I don't know about your case in particular, but for most people, what happens is that the rectum muscle is so tight that nothing passes through. So it's like having a toothpaste with the cap on. No matter how much you squeeze the toothpaste, which is your colon contracting, nothing is going to pass through as long as that rectum is closed and that muscle is not working. So what do we do for that? Number one, we have testing for that. We can test to see how well the muscles of the rectum are working. But like any muscle, like if I hurt my shoulder, I go through physical therapy. For the rectum muscles as well, if you hurt that, you need to go through physical therapy or biofeedback therapy as well. And we offer that. It's a great effective option. And this is one of the reasons why people may not respond to laxatives if they're constipated, because of this condition. We can get this taken care of for you. Great question, Sebastian. All right, guys. I want to thank you for watching. Thank you for joining me on the live show. Send me your questions. Send me via DM on Instagram, on YouTube, or Facebook. And if you haven't already, 2 favors. Number 1, smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. I can tell you this is going to be the easiest, most effective way to have me answer your questions and to have a response on that as well. By far, I check all my emails, and this is going to be the best way for you to respond. I want to thank you for watching. I'll see you guys next Tuesday. And don't forget to share the video, guys. Please, thank you so much. Hope you guys have a happy and healthy day. Take care. Bye.